If you were asked to name the world's deadliest virus right now, you'd probably guess COVID-19, right?
Oh, for sure. Or maybe HIV.
Yeah, exactly. But according to the campaign materials we're looking at today from the World Hepatitis Alliance, there is this virus quietly killing over 1.3 million people a year.
It's a staggering number.
Right. And depending on which data set in this report you look at, viral hepatitis is actually either the deadliest communicable disease on Earth or, well, second only to COVID-19.
Yeah, the scale is just massive.
But the craziest part of this deep dive isn't even the death toll. It's the fact that we already have the cheat codes to defeat it, yet we are somehow actively losing the war.
I mean, we're looking at an entirely preventable global health crisis here.
Right.
We possess the scientific tools to completely eliminate it, yet the data shows humanity is actually moving backward. The mortality rates are climbing, not falling.
Okay, let's unpack this. Because the sheer scale of this problem is, frankly, really hard to wrap your head around.
Oh, absolutely.
Especially for something you rarely hear anyone talking about in, daily life. So looking at the materials for the 2025 World Hepatitis Day campaign, there are some massive numbers thrown out right away.
Yeah, the statistics are pretty jarring.
They state there are over 287 million people currently living with hepatitis B or C. But then, flipping just one page over in the exact same campaign site, it rounds that figure up to over 300 million people.
Right, there's a bit of a gap there.
Yeah, and then one bullet point says more than 1.3 million die each year, while another specifies 1.34 million. What is going on with the math here? To me, this statistical fuzziness feels like an analogy for the disease itself. It's like a fire burning inside a house with no smoke alarms.
That's a great way to put it. And, what's fascinating here is that statistical variation isn't a case of sloppy reporting or, bad math by the alliance.
Wait, really? It's intentional?
Well, not intentional, but it is a direct reflection of the biological reality of this virus.
Yeah.
Public health organizations, they're relying heavily on estimates.
Because they can't track it accurately.
Exactly. They use mathematical models and lagging indicators, like a sudden spike in liver cancer diagnoses or, end-stage mortality rates,
Yeah.
just to figure out how widespread it actually is.
Because it's completely asymptomatic for so long.
Right. The data naturally struggles to capture the full scope of the crisis because the virus basically operates in the shadows.
Wow. I'm just trying to visualize how 300 million people, which is, by the way, roughly the population of the entire United States, can be walking around with a deadly virus and not even realize it.
It's hard to fathom.
How does the body just ignore something that destructive?
It really comes down to the unique biology of the liver itself. The liver is, it's an incredibly stoic, highly resilient organ.
It just takes the punishment.
Basically, yeah. It's responsible for filtering toxins, aiding digestion, regulating metabolism, so it's built to take a beating.
Right. It's the body's filter.
Exactly. But more importantly, the internal tissue of the liver doesn't have nerve endings that register pain in the way we typically experience it.
Oh, wow. Meaning you aren't going to feel like a localized ache or a sharp pain as the virus starts attacking the cells.
No, you feel absolutely nothing for years, sometimes decades. I mean, hepatitis literally translates to inflammation of the liver.
Okay.
So when someone contracts chronic hepatitis B or C, the virus sets up shop and triggers this slow, continuous inflammation.
And without the pain receptors, you just have no idea.
Right. Over time, that inflammation leads to fibrosis, which is basically scarring of the tissue.
Right, scar tissue.
And the liver is famous for its ability to regenerate, right? So it constantly tries to heal itself, which ironically just creates more and more scar tissue.
Oh, man. So it's fighting a losing battle against itself?
Yeah, but the organ compensates so well that it can continue to perform its vital functions even when it's severely damaged.
So a person just goes about their life, maybe feeling a little fatigued, but otherwise completely normal.
Exactly. Right up until the damage crosses a critical threshold into cirrhosis.
Which is the severe scarring.
Yeah, severe irreversible scarring. Or until the mutated cells develop into liver cancer.
Jesus.
By the time someone experiences the classic visible symptoms, like jaundice, the yellowing of the skin and eyes,
Right.
or severe abdominal swelling. At that point, the liver is already in a state of catastrophic failure.
So it's way too late.
Often, yes. And because people don't feel sick during those preceding decades, they just don't get tested.
And if they don't get tested, they aren't in the data.
Exactly. They aren't counted in the data until the damage is already done.
Okay, before we go further into the campaign itself, I want to clarify something. The report consistently lumps hepatitis B and C together when talking about the 300 million people affected.
They do, yeah.
But these aren't just like two flavors of the same thing, are they? Because if we're going to understand how to fight this, we need to know what we're actually fighting.
Oh, definitely. They are completely different viruses. They just happen to target the same organ.
Okay, so what's the difference?
Well, hepatitis B is a DNA virus. It's highly infectious and is most commonly transmitted from mother to child during birth.
Wow, right at birth.
Yeah. Or, through contact with infected blood and bodily fluids. When an infant contracts hepatitis B, their immature immune system usually just can't fight it off.
So they're stuck with it.
Exactly. It becomes a chronic, lifelong infection.
And hepatitis C, how is that different?
Hepatitis C is an RNA virus,
Mhm.
and it is almost exclusively bloodborne.
Bloodborne. Okay.
Yeah, so we see it transmitted through sharing unsterilized needles, or maybe unscreened blood transfusions, or inadequate sterilization of medical equipment.
So it's more about exposure later on.
Right. Unlike B, which often starts at birth, C is typically contracted later in life.
Got it.
But both of them lead down that exact same silent path: liver inflammation, cirrhosis, and ultimately liver cancer.
Which explains why they group them together in the reports.
Exactly. That's why they are grouped in these global mortality statistics. They are essentially the twin engines driving liver cancer worldwide.
Okay. Which brings me to the part of this deep dive that genuinely made me pause. I actually had to reread the report multiple times to make sure I was getting it right.
Yeah, it's pretty surprising.
You read about these two viruses, you see the 1.34 million annual deaths, you see the 2 million new cases every single year, and the natural assumption is that we're just helpless, right?
I think so. Yeah.
You assume we just don't have a cure. That science is still trying to crack the code in a lab somewhere, staring through microscopes.
But the sources reveal a very different reality. We actually have all the medical tools required to stop this right now.
Here's where it gets really interesting. The text lists out these medical triumphs, and they are honestly staggering.
They are.
We have fast, highly accurate diagnostic tests. We have incredibly effective treatments. And for hepatitis C, the treatments aren't just like managing the disease.
No, they're direct-acting antivirals.
Right. They can actually cure the infection completely in a matter of weeks. The pills just eradicate the virus.
Which is incredible. I mean, a true cure for a chronic viral infection is one of the rarest and most significant achievements in modern medicine.
It's basically a miracle. And on the hepatitis B side, while there isn't a simple cure for a chronic case yet, there is a proven safe vaccine.
Yes.
The report highlights that if administered to a newborn, this vaccine is 95% effective at preventing them from ever contracting hepatitis B in the first place. 95%.
It's massive. We essentially possess the complete medical arsenal.
Yeah.
A vaccine to shut down the primary transmission route of hepatitis B, and a pill to completely cure hepatitis C.
So the World Hepatitis Alliance explicitly states in this campaign that their goal is total elimination of the disease by 2030. They write in bold text, "We already have everything we need to achieve this."
And medically, they're entirely correct.
But I am struggling to reconcile these two realities. Like, if we have the literal cheat codes to beat this, if we have 12-week cures and 95% effective newborn vaccines, how can the very same source material claim that the world is moving backwards?
It's a paradox, isn't it?
Totally. Like, deaths are rising. If the science is flawless, why is public health failing so miserably?
Well, answering that requires stepping out of the laboratory. We have to look at human sociology.
Okay, sociology.
Yeah, the campaign materials make it very clear that the primary roadblocks preventing elimination are no longer biological.
What are they then?
The barriers are low awareness, widespread misinformation, cultural myths, and deeply entrenched stigma.
So we are essentially fighting human nature at this point, not viral nature.
That's exactly it. The medical tools only work if they actually reach the patient.
Right.
But these sociological barriers, they act as an invisible wall between the public and the clinic.
A wall of stigma.
Let's look at stigma, which the campaign heavily emphasizes. Because of how these viruses are transmitted, they carry a heavy burden of societal judgment.
Oh, I see.
Hepatitis C, being bloodborne, is frequently associated with intravenous drug use. And hepatitis B can be sexually transmitted or linked to marginalized communities.
So people associate the disease with behaviors that society already stigmatizes.
Exactly. Add in the widespread misinformation, like people falsely believing you can catch it from sharing a meal or hugging or casual contact, and you create an environment of intense fear and isolation.
Wow. So they think they're contagious just by being in the same room.
Yes. So if a person suspects they might have been exposed, the fear of the social consequences often outweighs the fear of the disease itself.
They're more scared of the rumor mill than the virus?
Totally. They are terrified of being shunned by their community or losing their job or even being judged by their own doctors.
Yeah.
So they just avoid getting tested entirely.
They stay in the shadows, hoping they are part of the lucky few who don't develop cancer, rather than risking the immediate social fallout of a positive test.
And because they don't get tested, the virus continues to quietly destroy their liver. And tragically, it continues to spread to others.
Man. But, I'm looking at this from the perspective of the decision makers, though. The sources draw a direct causal line between this public stigma and a lack of government funding. The text argues that low awareness and stigma lead directly to a lack of action by decision makers.
Yes, that's a huge point in the report.
I mean, I completely understand why an individual terrified of losing their job won't walk into a clinic, but health ministers and politicians look at spreadsheets, right?
They do?
They look at mortality rates. If 1.34 million people are dying globally, why would a politician care about stigma? Shouldn't the sheer math of the death toll force their hand to fund vaccines and treatments?
If we connect this to the bigger picture, you have to think about public health funding like a city deciding which potholes to fix on its roads.
Okay, potholes. I'm listening.
A health minister might have a budget that can only cover, say, a fraction of the diseases impacting their country. They have a spreadsheet showing the death toll of hepatitis, yes,
Right.
but they also have spreadsheets for 10 other diseases. And for those other 9 diseases, there are massive advocacy groups holding rallies in the town square.
Right. PR campaigns.
Exactly. They're lobbying the government, they're dominating the news cycle. There are furious citizens demanding that their specific pothole gets paved immediately.
So the squeaky wheel gets the grease, or in this case, the funding.
The squeaky wheel gets the budget, and the hepatitis suffers. They are utterly silent because of the stigma.
Because they're hiding.
They are hiding. They are not marching. They are not forming powerful lobbying coalitions. And they certainly aren't calling their local representatives to demand access to direct-acting antivirals.
Wow.
For a politician trying to survive the next election cycle, an invisible constituency is the easiest group to ignore.
They can literally look at the spreadsheet, see the million deaths, and still choose to redirect the funds to a louder, more publicly acceptable health crisis.
Without facing any political backlash whatsoever.
That is a terrifying dynamic. The very shame that prevents an individual from getting a diagnostic test is simultaneously providing political cover for a government to withhold the cure.
It's a vicious cycle.
Right.
Without public pressure, there's just no political will. The silence of the disease biologically is perfectly mirrored by the silence of the disease politically.
Which brings us to the actual battle plan. If the obstacle is human psychology and, frankly, political cowardice, how does a health organization fight that?
It's a huge challenge.
Looking at the World Hepatitis Alliance's blueprint for the 2025 campaign, their overarching theme is simply, let's break it down.
Yeah, breaking down the behavioral and systemic barriers that are holding back the medical rollout.
And to understand the scale here, this alliance involves 400 member organizations operating across 120 different countries.
It's a massive global effort.
Right. They are trying to coordinate a synchronized global shift in behavior.
Yeah.
And looking at this 2025 blueprint, it's wild. They list 4 main targets, but none of them are medical goals.
No.
They aren't trying to optimize a vaccine or invent a cheaper pill.
Yeah.
So what does this all mean? The entire 120-country strategy is basically a massive behavioral psychology experiment.
It really is. Synthesizing those goals reveals a fascinating approach to modern global health. The alliance is basically operating on the premise that you have to build the societal infrastructure before the medicine can even travel down the road.
Okay, let's look at how they are actually doing that. One of their major directives is to turn decision makers into advocates who actively provide resources.
That's key.
And that word choice advocate really stands out. They don't just want a politician to sign a funding bill, they want them to become an advocate.
Right, because a signature on a budget line is passive.
Right.
It allocates money, sure, but it doesn't change the culture. When a health minister or a prominent politician becomes an active advocate, they use their platform to normalize the conversation.
They make it okay to talk about.
Exactly. They stand in front of microphones and talk about hepatitis B and C the exact same way they would talk about diabetes or heart disease.
Ah.
They remove the moral judgment from the virus.
They paved the road, basically.
Yes. Once a respected figure is visibly championing the cause, it provides a sort of permission structure for the affected communities to step out of the shadows.
It signals that it is safe to seek testing and treatment without fear of ostracization.
Exactly.
Another core piece of their blueprint is focused entirely on ending the stigma to ensure no one is left behind, paired with giving everyone the knowledge to make informed choices.
Again, very socially focused.
Yeah, again, it's a communication strategy.
Yeah.
But how does an alliance of 400 organizations actually execute the end of a stigma on a global scale, like logistically?
Well, it requires hyper-localized messaging.
Meaning what works in one place won't work in another.
Exactly. The stigma in a rural community in Southeast Asia regarding hepatitis B might be rooted in completely different cultural myths than the stigma surrounding hepatitis C in, say, an urban center in North America.
Oh, that makes sense.
The alliance provides the overarching framework, the
Hey.
scientific truth that these are simply viruses, not moral failings,
Right.
But they rely heavily on local organizations to translate that into culturally resonant campaigns. It involves educating community leaders, integrating testing into routine health checkups so it doesn't feel targeted.
Oh, so just making it part of standard blood work.
Exactly. And dismantling the false narratives about casual transmission.
Because by taking the fear out of the equation, you create public demand.
Yes.
And once there is loud, visible public demand, the politicians are forced to respond with the funding and the rollout of the vaccines and the treatments.
Which leads right to the Alliance's final goal, which is to achieve global agreement that elimination by 2030 is truly achievable.
2030, that's so close.
It is. But they have to convince both the public and the policymakers that this isn't just a pipe dream. The 2030 deadline is completely biologically feasible.
Right, because of the cheat codes.
Right. The only variable is whether we can organize ourselves socially to pull it off.
So bringing this all back to you, the listener, why should you care about a campaign strategy for World Hepatitis Day?
That's a fair question.
Well, consider the raw numbers we started with. 300 million people living with this. 2 million new infections happening every single year.
It's staggering.
A disease with that massive of a footprint is constantly moving through our global community.
Yeah.
It isn't happening in a vacuum, and it isn't isolated to some distant corner of the world.
No, not at all.
It is in our cities, our neighborhoods, and quite possibly our own social circles, just quietly going unnoticed because the liver hides the damage and society hides the conversation.
It really serves as a stark reminder that medicine is only one half of the public health equation.
Right. Public health isn't just about the brilliance of scientists in lab coats peering into microscopes. We have literally already won that half of the battle.
We have.
We have the 12-week cures. We have the 95% effective newborn vaccines. The other half of the equation is entirely about how we talk to each other. It's about the information we share, the cultural myths we refuse to challenge, and the environments we create. Whether someone receives a life-saving, highly effective pill shouldn't depend on whether they feel too ashamed to walk into a clinic and ask for a test.
This raises an important question that extends far beyond just the fight against hepatitis.
Oh, what's that?
Well, we are looking at a scenario where humanity has achieved the ultimate medical triumphs over a deadly pathogen.
Right.
We isolated the viruses, mapped them, created rapid diagnostics, formulated affordable cures, and engineered highly effective vaccines.
We did everything right.
The science is completely victorious. Yet this disease is still spreading and cutting short over 1 million lives every single year solely because of human factors like misinformation, fear, and stigma.
It's basically the tragedy of holding the fire extinguisher while refusing to put out the fire because you're worried about what the neighbors will think of the foam on the lawn.
That's exactly it, which forces us to look at the bigger picture of our future. As our medical technology becomes increasingly miraculous, are the greatest threats to our survival in the 21st century still biological?
Wow.
Or are they informational? If we have the capacity to cure the incurable, but we lack the societal trust and communication to actually deliver those cures, what is the real danger facing humanity?
That is a haunting thought to leave on. The most dangerous thing in the room might not be the virus itself, but the stories we tell ourselves about it. Thank you for joining us on this deep dive into the silent crisis of viral hepatitis and the 2025 campaign to finally break it down. We'll be back soon to unpack more. Until then, keep asking questions.